Hi everyone. This is week 2 of the Men's Empowerment Workshop. The recording I did live did not work out so well. It malfunctioned, so I'm recording it again. And so whenever we get to an activity, answer questions, there's a stress handout that we have in this session. I'm going to ask you to pause the recording, and in that way you can work on it, and then when you're ready to proceed, you can press play again. So this week we're going to talk about heart disease, stress, and rest. Heart disease is one of the main killers of men, and both men and women actually. And stress, as it turns out, is one of the major factors. And it goes beyond heart disease. Stress is actually one of the major components of chronic disease. It's estimated around 80% of chronic diseases are caused by stress at some level. And so stress is not only good for the heart and the cardiovascular system, but it's really important for our entire body and general wellness. And we're going to talk about rest and stress reduction because that helps to pretty much empty our reservoir of stress. It helps us release that stress and get back to a healthy and happy state. Now, first of all, take some time to reflect on how your health was this past week. Last week, we set the foundations for basic health and wellness, and I asked that you keep track of something, whether it's your energy, your water intake, your sleep, and monitor how you were proceeding for your goals, because we actually also set a goal for last week. And so take some time to reflect on that. There is a handout that tracks your goals week by week, and so take some time to fill that out. Okay, so what is heart disease? There's a lot of different types of heart diseases, and so let's go over those now. Okay, so first of all, you have your heart attack. That's also called a myocardial infarction. What happens here is that blood flow to part of the heart is blocked, and that causes damage. Any cell, any tissue that isn't getting blood isn't getting oxygen, and it's not getting nutrients. And the oxygen especially, that leads to death fairly quickly. Within minutes, cells start to die. And so obviously if there's blood not getting to the heart, that's going to be really bad. And so that's called a myocardial infarction, also called a heart attack. Um, and that has many risk factors, which we're going to get into later. Symptoms of that, you probably know the general kind of classic symptoms, the chest pain, it might radiate down the left arm, might radiate to the jaw. And so those are your basic symptoms of a heart attack, but there are others. Okay, so next is the ischemic stroke. And this is actually most common heart disease. And so ischemic stroke is when, and here we see the blood flow again, blood flow to part of the brain gets blocked or interrupted. And this causes damage to the brain. And since the brain controls every part of our body, this can lead to all sorts of symptoms. Common issues are going to be paralysis of one side of the body, numbness of one side of the body, drooping of the face, difficulty speaking, and changes in cognition. And so, again, we have issues here with the vasculature, and blood is being interrupted, and that causes damage. Blood flow is so important to the health of the body. Next, we have congestive heart failure, or CHF. And what's happening here is that the heart can't get enough blood to cells of the body. And so it's failing to pump blood adequately throughout the body. And this is more of a chronic issue where heart attack and ischemic stroke, those are more acute instances. And so CHF, or congestive heart failure, is a chronic condition that develops over time. And a lot of times one of the issues is high blood pressure. And so if there's a lot of pressure for the heart to pump against, it takes a lot of effort for the heart to get the blood out. And then eventually the heart just can't pump hard enough. And places like the kidneys or peripheral tissues like the feet, they don't get enough blood flow. And so damage occurs, and it's more of an insidious long-term damage. But over time, this gets worse and worse. The heart starts to compensate, just like any muscle. If it's pressured and stressed, it will grow, it will get bigger so that it can perform more work. But in the heart, that's not a great thing because when the heart gets really muscular, it's not able to relax and fill up with enough blood. Actually, the chamber gets even smaller. And so less blood is filling up, and it's not able to relax to get that elastic ability to expand. And so, because of that, each time the heart pumps, it actually pumps less blood. And so, obviously, this is just creating more issues. Arrhythmia is the next one. This is just an irregular heartbeat. Atrial fibrillation, or AFib, is one type. People can live with AFib even though their heart isn't working as efficiently. They can live with that. Whereas if you have ventricular fibrillation, or VFib, that's life-threatening. Um, and there are different risk factors for this. But yeah, it's just another type of heart disease. Okay, next, heart valve issues. These can be put into two different categories: stenosis, which is a hardening and a narrowing, so the valve isn't opening enough, and a prolapse, and this is commonly called a leaky valve. And so people that have leaky valves, the valves are there to stop the blood from going backwards. In the cardiovascular system, you want the blood to keep flowing in the same direction. That way you get circulation out of the heart to the body, back to the heart, then to the lungs, heart again, and then back to the body. And that ensures a constant flow of oxygenated blood to the body, and then when the blood returns to the heart, it can then send it through the lungs to get more oxygen. With the leaky valve, you have blood going backwards through the heart, and that's another loss of efficiency. And same thing with stenosis, you just don't have as much blood flow going through the heart. Now, a major component in heart disease, and a major risk factor, is what's called metabolic syndrome. And if you remember, syndrome is just a collection of symptoms and signs that tend to come together and relate to a disease condition. And so metabolic syndrome is strongly linked to cardiovascular events, cancer, and mortality. And so we're going to talk about what metabolic syndrome is, but it's really important and it's really common in our society. Okay, so let's talk about overall risk factors. Now, on the left, we have disease conditions. High blood pressure is one. High cholesterol in the blood is another, and this is linked to atherosclerosis. What atherosclerosis is it's hardening of the arteries that's caused by cholesterol deposits into the vessel walls. And so what happens is it's the LDL cholesterol, which is considered the bad cholesterol. This gets oxidized, and we're going to talk about oxidation and oxidative stress in week 5. And so the cholesterol gets oxidized. The immune cells, the macrophages, they eat it up, and then those turn into these bloated foam cells that just end up getting deposited into the vessel walls. And so over time, the vessel walls get pushed out, and that causes a narrowing of the arteries. And if that's not bad enough, what could happen is that this plaque, which is all those deposited cholesterol and foam cells, that plaque can actually break off and start floating through the blood. And this is the clot. And then that can get lodged in, it can get lodged in the brain, in the vessels of the brain, and then stop blood flow. And then you have an ischemic stroke. And so high cholesterol is one of the factors in that whole process. Another one is diabetes and high blood sugar in general. And this leads us to metabolic syndrome. So metabolic syndrome is a collection of increased blood pressure, increased blood sugar, excessive abdominal fat, and abnormal cholesterol levels. So as you see, the top 3 disease conditions, and then you throw being overweight, which we see in the lifestyle side, all those together form metabolic syndrome. And metabolic syndrome is a very poor indicator of the health of the cardiovascular system. And really, not even just the cardiovascular system, but in general, just the health of the body. So lifestyle. We have risk factors for lifestyle. First of all, an unhealthy diet. We're going to see that throughout. The diet is so key that An unhealthy diet is going to lead to issues of any body system. But now, when we talk about diet, is it really the fats? Um, we've been in a low fat craze for a few decades, and it seems to be turning around. But for a while, fats were thought to be the main issue with cardiovascular disease. Because one of the other things that is linked to cardiovascular disease is high blood levels of lipids or fats. And so, but are dietary fats a problem? And so for a while it was all fats are bad, and then it was okay. Well, the polyunsaturated fats are good, and unsaturated fats are good, but saturated fats are bad. But even now, we're finding out that that's not the case. And I read an article recently that linked to a study that it actually the source of saturated fats is very important. Not all saturated fats are good or bad. And in general, plant-based saturated fats, like in seeds, nuts, coconut oil has a lot of saturated fats, those tend to be healthier and better for the body than animal-based fats, saturated fats. And I would even go a step further. And the question I would ask is, well, does it depend on the quality of the meats and how they're raised? And there's already been some science and studies that suggest that yes, this is the case. There was one where they tested the actual fat content of animals raised on a grain diet versus a grass-fed diet, and the cows fed grass. They had a much higher ratio of omega-3s to omega-6s. And those are both unsaturated fats. But the omega-3s are more anti-inflammatory and generally thought to be good, whereas the omega-6s tend to be more pro-inflammatory and thought to be not as good, especially if they're higher in ratio, the ratio is off between them and omega-3s. And this is generalizing it. But basically the point of that is saying that how the animal is raised does affect the content of the meat and definitely the fats that are in it. And so it definitely isn't a big stretch to think that the way that animals are raised, whether they're fed their normal diets or an abnormal diet, I would even venture to say the amount of exercise they get, the living conditions, whether they're being pumped full of hormones and antibiotics, this will affect the content of the meat. And I would also guess the quality of the fats and even the saturated fats. Okay, so fats really are becoming less and less the bad guy. Fats are necessary. We need to get our fat soluble vitamins. And more and more the issue is looking like it's carbohydrates, and especially simple carbohydrates and sugars. And too much of that and too little of the complex carbs and the fibers. And so as far as a healthy diet for the cardiovascular system, it really comes down to decreasing the sugars and of course decreasing the processed foods and even increasing some healthy fats like omega-3s, fish oils, and plant-based omega fats. Okay, next in lifestyle, physical inactivity. This should be a no-brainer. We're going to get to exercise in week 4, but basically aerobic exercise is going to be good for the heart, but even strength exercise, basically moving the body, getting the blood pumping, getting the heartbeat elevating, and increasing the fitness of the cardiovascular system, that's really important. Obesity, being overweight, it puts a lot of strain on the heart and the cardiovascular system. And so if you have a lot of adipose tissue, which is fat, there are vessels that have to send blood to those cells. And the more vessels you have, the more the heart has to pump to get blood through all of those vessels. And so if you have a lot of vessels, that's a lot of work for the heart. And then it has to pump harder, and the blood pressure goes up, and all these other processes start to spin out of control. And so having a weight that is easy for the heart and the other organs to maintain, to be able to fulfill their jobs with the amount of body weight is really important. Next, excessive alcohol use. That's more than 2 drinks per day in men. That's an issue, again, for throughout the body, but also definitely the heart. And same thing with tobacco use. Tobacco use, it's not good for the health. And so use of tobacco is another risk factor for cardiovascular disease. Other factors that play a role, being a male, men do suffer from cardiovascular disease more than women, but women also suffer from it. But being a man already puts you at risk. Having a family history, just like anything else, there is a genetic component. And so if you have a family history, that's going to put you more at risk. And also age. As we get older, we get more and more increased risk for cardiovascular disease, especially over ages 45 and 55. That's when the risk really goes up. Now, if you look at these risk factors, some of these are in our control. Some of these aren't. The other factors, being a male, your family history, your age, these are things that that you can't control. But the lifestyle, you definitely can control. And the other disease conditions, there are things you can do to manage and to make it better. And so, when it comes to risk factors, it's really important to keep in mind that you're never going to have a zero risk. There's always going to be a risk of getting something. You can be the healthiest person out there and still get a disease. And that's just the reality of being alive and being a human. But the point is to do all the things that you can to decrease your risk and to increase your health. And that can make up for those other factors that you can't control. And so instead of focusing on the things that you can control, be aware of those things that you can't control, and then do what you can to mitigate those risks and to increase your overall health. And so now I'd like you to take some time to fill out the first two questions on the week 2 Men's Empowerment worksheet. How prevalent is heart disease in your family? And do you have heart disease? And what risk factors do you have? And just become aware of some of the risk factors that you have, and especially look at the ones that you can't control, and then look at the things that you can control. And then we're going to get into what sort of lifestyle behaviors, especially in the stress reduction, can you do to decrease your risk even more. So pause this video and take some time to fill out the first two questions. Okay, now we're going to talk about stress. Stress, everyone's heard about stress, everyone's felt stress before, but what exactly is stress? It's not always clearly defined, and actually, if you look it up, the definitions can vary. So first of all, is stress a problem? And yeah, it's a big problem. According to the World Health Organization, nearly 500 million people worldwide suffer from stress. And that seems like even a low number. But if that is the accurate number, a lot of them live in the US. More than 3 out of 5 doctor visits are likely associated with stress-related issues. So 60% of doctor-related visits, that's huge. And if you're trying to cut down the amount of doctor visits that you have, really look at the stress component. And then at the bottom, 80% of workers feel stress on the job, and nearly half say they need help in learning how to manage stress. So half people actually acknowledging they need help managing stress. And 42% say their coworkers need such help. So basically, it seems like everyone either acknowledges they need help with stress, or they're saying that their coworkers need help with stress. And the reality is we all need help with stress. Stress is a ubiquitous part of life. And so we really need to look at it as something that is part of our daily routine. So what is stress? Some people talk about stress just as mental or emotional, but I'm going to define it as physical, mental, or emotional. And there's all sorts of stresses. And so it can even be psychological, it can be financial, it can be oxidative, it can be interpersonal. There's all sorts of things that can stress us. So what are some of the effects? Depressed immune system. And so so first of all, the main stress hormone, one of the main stress hormones is cortisol. And also you have your adrenaline neurotransmitters of epinephrine and norepinephrine. But cortisol is a hormone that gets your body into a state of readiness when we're stressed. And one of the elements of being ready for an acute danger or threat, which is what's really what stress is, it's something that's threatening the body. And so uh, when the body's responding to that, it's going to decrease or inhibit any process that isn't helping us survive right now. And so when you're in that fight or flight response, which again is going to be mediated by your adrenaline, but cortisol is also going to be a part of that whole process. But we're in fight or flight. Basically, we need to fight or flee. And so there's going to be a lot of blood to the skeletal muscles, but anything related to immune function, digestive function, anything that's not helping us survive right now is going to take a back seat. And so cortisol inhibits the immune system. It's anti-inflammatory, and it's why cortisol analogs are used for injections or even topically for certain like skin-related inflammatory conditions. Now, again, this has its benefits, but over time, if you have a depressed immune system, you are more apt to get infections. Stress, we talked about the increased incidence of chronic disease, poor sleep, and poor energy. Cortisol has a rhythm. Cortisol increases early in the morning, helps wake us up. That's good. And then it's supposed to decrease over time. It has a little hump later on in the day, but it decreases over time. That allows us to go to sleep. And as cortisol decreases, melatonin increases. Now, if you have issues with cortisol, sometimes what happens is that the cortisol rhythm is thrown off. The rhythm is thrown off where our body isn't responding as well to cortisol, and so it takes us longer to wake up. And even our energy is going to be lower because we're just not in that state of the get up and go because our body sees so much cortisol, it's just numb to it. And then, as the body makes more and more cortisol to keep you up, now at night your cortisol levels are high. And sometimes people have this rush of energy, their second wind late at night, and then they have problems sleeping. And that's because the cortisol is too high. It hasn't gone down yet. And so the rhythm's completely off. And if you get poor sleep because your cortisol is high and you had trouble sleeping, now your energy is going to be off because you didn't get enough sleep. And the cycle repeats. Difficulty waking up, poor energy, and then the cortisol spikes too late, difficulty falling asleep, and now poor energy and difficulty waking up again. Headaches, migraines, pain. These are other causes or effects of stress. Mood changes and mood lability, emotional lability, going back and forth, getting angry at the drop of a hat. These can also indicate high levels of stress. Hormone imbalance, we talked about the cortisol element. Blood sugar dysregulation, another thing that cortisol does is it increases blood sugar in the blood. Well, of course it's in the blood, but it increases blood sugar. And so if you have diabetes or pre-diabetes or any sort of high blood sugar issues, cortisol is going to make that problem even worse. And the reason why it does this is because when you're in a fight or flight response and your body is mobilizing all of its resources to make sure that your muscles have enough energy to do whatever they need to do to survive. And so increasing the blood sugar provides all that fuel for the muscles to use. And lastly, digestive issues, and this can be gas, bloating, constipation, diarrhea, a whole host of others. And basically, the body is not concerned about digestion if you are in imminent danger and need to survive. So take some time right now, pause the video, and take some time to fill out question number 3 on the handout because these are the stress effects that are commonly seen in people. But how does stress affect your life? What role does it play in your life, and how does it, how does it affect your life and make or decrease the quality of your enjoyment of life, the quality of your health, any of those things? Just write down um, how stress affects you. Okay. So just to reiterate the how stress affects our physiology, this is a quote from Dr. Daniel Goleman. Whenever we feel stressed out, that's a signal that our brain is pumping out stress hormones. If sustained over months and years, those hormones can ruin our health and make us a nervous wreck. And so when you feel stressed out, there are changes inside of your body that are making you feel that way. And those changes are not good to sustain over time. And that's really one of the key elements because we're going to talk about now that stress isn't just a bad thing. So we have different types of stress. We have negative stress or distress, and we have positive stress or eustress. And Hans Selye, who is the father of the stress response of organisms, how they adapt to stress and respond to it, he even said it's not stress that kills us, it's our reaction to it. And so we have the capacity to have positive responses to stress. And now, one way to kind of illustrate this point is to talk about astronauts. Now, when astronauts go to space, one of the major issues that happens when they're in space for a while is their bone density decreases. And so the strength of their bone is less. And this is a major problem. And so why is this happening? This is because gravity is no longer there to pull on the skeletal system and create this stress within it. Because it's the stress on the skeletal system that tells it to grow and adapt and strengthen. And without that stress, our body, and especially our bones without gravity, weakens. And so we need stress to keep us strong. Another example of stress is exercise. Exercise is putting a physical stress on our body, on our muscles, on our bones, on our cardiovascular system. And when that stress isn't there, those systems suffer, they get weaker, and they get diseased. And so, stress, we need some amount of stress. So, on the left side of this graph, you see that if our body is bored, if it's not pushed at all, then that we increase the risk of our ill health on that side, and we have poor performance. Now, as we start to add stresses, our performance and the fitness and health of our body increases to a point. And this is where we get to functional stress. This is exercising, an hour a day. This is doing things in our lives that are challenging, but we get reward out of it. And so these are things that we need to be healthy. But if we put too much on our plate and too much stress and too long of time, and it becomes to overwhelm us. And so this is where it becomes distress. It's too much stress. If someone's exercising 20 hours a day, that's not that's way too much. But 2 hours a day, that's healthy for some people. For those of us, if you don't have high fitness right now, it may be too much stress, too much too soon. And so we all have different levels that we can tolerate. But as we stress ourselves, if we're in that functional stress level, right in that sweet spot, our body will adapt so that we can tolerate more and more. And that's the idea of exercising, that we exercise and then our body adapts to it, and then we can increase how much we exercise or increase the intensity or the duration. And then over time, our body gets stronger because of it. And so that's really important to know that stress is not a bad thing, but it's about keeping it in that sweet spot. Too little and we won't grow, we won't adapt. too much, and it's going to burn us out, and we're going to be, it's going to overwhelm us. Some warning signs of stress. If you want to read all of these, you can pause. I'm just going to go over a few. And so, cognitive symptoms, symptoms of the mind, memory issues, inability to concentrate, poor decision making, these things where you just feel like your brain isn't working well, that could be a warning sign for stress. Emotional issues, we talked about some of these. Being moody, irritable, easily agitated, can't relax, feeling overwhelmed, you might feel lonely or depressed. These are signs that you might be stressed. Physical symptoms, aches and pains, diarrhea and constipation, those GI symptoms, nausea, dizziness, all sorts of things can indicate that from your body on a physical side that it's being taxed and it's not healthy and that you're overstressed. And then some behavioral symptoms, changes in eating habits. You might be eating more or stress eating. You might be eating less or and just you don't have an appetite. Your sleeping schedule can change. You might have problems sleeping, you might be sleeping a lot. Other issues, using alcohol, cigarettes, or drugs, that's self-medication. These behavioral changes can also indicate you're overstressed. And so this is important to see because if we can see how stressed we are, we can keep it from going on for too long. And so on this previous slide, we saw that it's really a balancing act between distress and eustress and getting as much eustress as possible. And now this can change over time. We can have family issues, our own health can change, and that can stress us out. Financial problems, increase more work at your job, all sorts of things can cause you stress. And so the amount of stress that you can tolerate or that you can delegate to other things like exercise and personal growth, this can change over time. And so you want to make sure that you know the warning signs for when you have too much on your plate, because then that's a sign to either take some off your plate or to increase your stress reduction to eliminate more of it. And so take some time now to think about how you respond to stress and think about what are some of the healthy stress responses you have, what are the good things do you do, and then maybe what are some of the unhealthy stress responses. The things that you do that you know doesn't increase, doesn't make you healthier, but it is kind of how you, um, you know, decrease, how you let loose, so to speak. And so take some time to answer questions number 4 and 5. Okay, and now I also would like you to fill out the stress inventory. And this stress inventory shows some major stressors that can happen. And now keep in mind that these are major stressors. And so there are other things, little things here and there that can stress us out that won't be on this inventory. But really take a look at have there been any major events in your life that could be major stressful events, because if you have had these in the past year, it's really important to do a lot of stress reduction, do a lot of processing to make sure that you can physiologically get past those events. Because sometimes when we're in a stressful situation, um, you know, we can plow through. We can just head down and just get the job done. And we don't always know how stressed we are inside of our body. Sometimes the signs might be beneath our awareness. And so do this activity to get some awareness. And if you have a low score, great. You didn't have any major stressors. If you had a high score, it's okay. We're gonna show you some stress reduction techniques you can do to manage it. And now even if you got a low score, keep in mind that it doesn't mean that you don't have stress. You will know based on how you feel, and if you look at some of those signs of stress, um, you'll there could be other indications that you have stress, and they could be low grade, low level stressors that are more insidious than something major. So pause the video and take some time to fill out that stress inventory. Okay, so now you know your stress level. Hopefully, it wasn't too high, but again, even if it wasn't, we're going to come up with some solutions right now. So first of all, we're going to talk about rest and recovery. How do we recover from the stress that we go through? We all go through stress. It's inevitable. It's healthy to a point. We need it, and so it's not really important to talk about if we're stressed and if we need to do stress reduction. Really, stress reduction is a necessary part. It's the other side of the coin of living, and so sleep is one component of that. Rest and recovery. And I want you to think of everyone knows that sleep is important, but also when we get to stress reduction, this is a daily thing. It's like eating, drinking water, brushing your teeth, all these things that we do daily. It's just sleep and stress reduction are also in that category. I like this quote: "Take rest. A field that has rested gives a bountiful crop." And this is important because sometimes things get in the way of us taking rest. It might be work, our job, chores around the house, family responsibilities. There's all sorts of things that can get in the way. And sometimes this is unavoidable, but we really need to know that it's not healthy, it's not good for us if we don't take rest. And if we don't make up for those days that may be struggles, we need to really make sure to rest. Because here's what happens: you might be decreasing your rest so that you can get more work done, but your work isn't as productive. You're not going to be thinking as well. You're not going to be enjoying what you do. You're not going to work as fast or as productively. And so that's where the bountiful crop is. When you are well rested, you will work better. And so sometimes, and especially if your work quality is suffering or any part of your life quality is suffering, take some rest because it will make you'll get more out of your life and you'll enjoy it too. So, um, let's look a little bit more at the importance of sleep because I think sometimes this is um, not especially with men, I've noticed a lot of men don't always get as much sleep as they probably should. So, difficulty falling asleep, unrefreshing sleep, and particularly loud snoring predicted the development of metabolic syndrome in community adults. Evaluating sleep symptoms can help identify individuals at risk for developing metabolic syndrome. So, here we see again metabolic syndrome, which was one of the major risk factors of cardiovascular disease, and the connection it has with sleep. Here's another one. Of the study population, 22% suffered from metabolic syndrome. However, it doubled to 48% among short sleepers getting 6 to 7 hours of sleep, and increased to an astounding 83% of those getting less than 6 hours of sleep. And so that is mind blowing. And so, if you want to keep your risk factors low for cardiovascular disease, you want to be aware of metabolic syndrome and what is under the category of metabolic syndrome. And here we see that sleep, if you're getting less than 6 hours of sleep, you have a very high chance of developing metabolic syndrome. 83% compared to 22% of the overall population. And so this shows just how important sleep is for our heart health. So what goes into good sleep? How do you sleep well? First of all, time. Most people need an average of 8 hours, but there's a lot of variety. In general, men tend to need less sleep than women, and just based on who you are in your individual body, you may need more or less. But time is important, getting quantity. Also, we need quality. And so if you're just lying in bed, just being in bed is not enough to get sleep. So if you are tossing and turning, if you're snoring a lot, or if you have any sort of sleep apnea issue where you're not getting enough oxygen into your body, if you're waking up a lot, and if you wake up and you just don't feel refreshed, These can show that the quality of your sleep is not good. And, because again, you could be laying in bed for 10 hours, but if you're tossing and turning the whole time, that's not good quality sleep. And there's an app you can get called Sleep Cycle, and while I don't like being next to electronics while I sleep, this could be useful to see how you're sleeping if you don't know. And you put this sleep app on, you put the phone next to you in bed, and it actually picks up how much you're moving at night. And it can show you your quality of sleep over time. It's supposed to go in rhythms because we have sleep rhythms. Your sleep schedule. And so we have a normal daily sleep rhythm, and they've done studies on this where they've seen that people um, removed from the sun, where they're kind of buried in kind of in rooms in the mountains, so they can't see if it's light or day out, and they look at their sleep schedule. And now we have almost close to a 25 hour natural sleep rhythm. But we do have certain times where we tend to be more tired. And this is linked to cortisol and melatonin. Now, when the sun comes out, the sun entrains us to that 24-hour cycle. And so that's why it's another reason why it's important to be outside and see the sun. That way our body knows what time it is. But anyway, when you get to bed is important. And for most people, this is being in bed by 10:30 p.m. Um, I know for me personally, if I get to bed after midnight, it doesn't matter how much sleep I'm getting, I'm not going to wake up feeling refreshed. And so, and this poses issues for people who have weird shifts at their job. And some of that can be difficult to deal with. And that's where, so if your sleep suffers, you really have to make up for it with the stress reduction, which we're going to get to next. Now, there is a handout in this week's um, component that talks about how to get healthy sleep. It's called sleep hygiene. It's the do's and don'ts of what to do at night so that you can get good sleep and get to bed and also sleep well. Okay, so now we are on stress reduction. And basically, the idea is stress is inevitable, it's going to build up in us over time, and so we need to take time to let it out. It's kind of like trash. Trash is going to build up in our lives. That's why we take it out to the garbage, and someone takes the garbage. The garbage man comes by and takes it to the landfills. If we didn't reduce the garbage in our house, then it would just pile up over time, and it would become a disgusting place to live. And the same thing with stress. If you don't take time to take out the stress, if you don't reduce it, it's going to build up in your body and lead to symptoms and diseases that are really nasty and uncomfortable. And so this is something that I recommend we do every day. Now, first of all, what are the 4 A's of stress reduction? Avoid it. Avoid the unnecessary stress when possible. If there's something that you can avoid, then take it out of your life, especially if it's not giving you any benefit. Now, this isn't always possible. Next, alter the situation. Maybe it comes from talking to someone. If you have a relationship issue, it could be someone, it could be a spouse, it could be a friend, it could be a coworker or a boss. Maybe by talking and communicating with them, maybe that can alter the situation. And so try that. Next, if the situation is still there, then maybe you need to adapt to it. And this definitely plays a role in exercise. Um, your body will adapt to the stress of the exercise. But sometimes stress could be good for us. It can force us to grow and to change. And so if you're adapting, you can be hopefully becoming a better person in the process. And then lastly, acceptance. Accept the things you can't change. There are some stressors that are inevitable. They may not be good for us, they may not be comfortable. But if we can't do anything about it, then don't dwell on it. And it reminds me of a quote from Gandhi, who says that pain is inevitable, but suffering is optional. And so there are things in our lives that are uncomfortable, that are painful, that we don't like. That we can't avoid. But to suffer and to stress over them, we do have, we can make the decision on how we respond. And that goes back to the quote of Hans Selye, who said, stress doesn't kill us, it's our response to it. And so it's really important to accept the things you cannot change. Also reminds me of this quote: God grant me serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. Sometimes just even knowing that this isn't something I can change, that can bring some peace of mind. Okay, we went over some unhealthy and healthy ways to deal with stress. If you didn't write those down, or maybe if you thought of more, take some time to pause the video and do that now. Okay, let's talk about some breathing techniques. So there are a lot of ways to decrease stress. It could be exercise, it could be talking to friends, talking to family, having date night with the spouse, whatever it is. But I want to go over some techniques of stress reduction that are free and that involve only you and that all of us can do. And the first of all is breathing. So deep breathing encourages complete oxygenation of the body. When we are stressed, we tend to hold our breath and breathe more shallow. And that's not good for the body. We need oxygen. But also physiologically, it leads to a change in our physiology. Now, also, the tendency during stress is to breathe, to keep the shoulders up and to breathe with that upper part of the chest and shoulders. That also does not promote relaxation, and it can lead to discomfort in the neck and upper back and chest. And so use your diaphragm, diaphragmatic breathing, which is using when your abdomen goes in and out. That's going to be much more relaxing. And then that allows your shoulders to relax. And then also add visualization for happy feelings. Think of a time, and this really um, gives your breathing exercise even more benefit. Think of some things that are happy, a happy memory that you had, spending time with your friends and family, doing a hobby that you enjoy, or maybe looking forward to something that's yet to come, like a vacation. When you breathe, and it's important, you want to breathe deeply, slowly, and completely. And so take a nice deep breath in through the nose, as deep as you can, and then let it out through your mouth. Purse your lips and blow out that air completely. Now, when you do this, you're going to feel relaxed. When you add the visualizations and the happy feelings, you're going to feel even more energized and relaxed. And so if there's something, if you have a lull in your day, your energy is low, your mood is sour, you're going to do something you don't want to do some deep breathing with visualizations and it will energize you. And you're going to be more and more excited or at least willing to do that activity that you might be resisting. Now there's many different breathing techniques, and so I encourage you to try different ones. Don't just stick with one, especially if you get bored of things. But here's a couple. One, okay, so one of them, you just breathe in and out, and you count your breath. And we'll talk about this when we go into meditation next. Just counting your breath. Count how many seconds it takes to inhale, and then how many seconds it takes to exhale. And there are many different patterns you can do. One pattern is just equal inhale as exhale. So you may start with 4 seconds in, 4 seconds out, and then increase to 5 seconds in, 5 seconds out, and then increase more and more. And without getting dizzy and passing out, you want to expand the breath as much as you can so it gets slower and deeper over time. So if you can get to 8, 10 seconds or more with inhale and then exhale, you're going to feel the change. It's very relaxing. You can do, there's some other techniques called the 6-2, 6 seconds in, 2 seconds out. Or actually, no, it's the 6-3, 6 seconds in, 3 seconds out, or the 7-2, 7 seconds in, 2 seconds out. You can also do the 4-4-4-4, 4 seconds in, hold for 4, 4 seconds exhale, hold for 4, and then repeat. Some of the important things are that you want to be focused on your breathing. Be focused on your diaphragm. Be focused on your abdomen. Focus on the relaxation of your chest and shoulders. Be in your body and be with your breath. When you notice your mind shifting and thinking about the things that you need to do, things that you have done, what do I have at work? I got to send that email. Just let those thoughts go away and go back to focusing on your body. That's a really big component of it. But if you want to focus, if you want to add a visualization, then you'll be focusing on something consciously, something happy, something that lifts you up and makes you feel better. Now, there is a guided relaxation link here. I encourage you to follow it and listen to it and try a few. Especially when we start doing relaxation at first, it can be difficult, our mind can wander, and so an audio where that we can listen to it and follow the prompts can help train us. So that way, when we're on our own, we can do it even better. Meditation. So this one, uh, most people are okay with the breathing techniques. The meditation does get a fair amount of resistance from some people. I've heard the I don't know how to meditate, or I can't shut my brain off, and then the I just get more stressed when I meditate. And so one of the things I want to say is that we all can meditate. And so sometimes it's just about picking the right meditation for you. And so you have two basic types. You have the focused attention, where your mind is focused on something. And then you have the open monitoring, where you're not trying to focus on something, you're just observing everything that's happening both inside of you and around you. So let's look at the focused attention. We'll go over a few types. Transcendental meditation, that's one that's fairly popular, where you repeat a mantra or a sound. And you repeat that over and over and over again. And that repeating of that word or mantra, that gives your brain something to focus on. And so it's not focusing on wandering and thinking about all the other stuff that's going on. It's focusing on one thing. Walking meditation. You can go outside, and I encourage you to walk barefoot, especially if there's grass around and it's comfortable. You can walk barefoot. And the focus is on walking as slowly and in as much balance as you can. Focusing on equal weight distribution throughout your foot, and then transitioning from one foot to the other in a very smooth and graceful manner. Again, you're focusing. And so for some people who have issues with doing a silent meditation, this could be really good because you're doing something. Same thing with candle meditation. And so for visual people, you can light a candle and gaze into the flame. And that flame, as it moves, you'll just keep your eyes on it, and that's giving you something to do. And the thing is, when you focus your words, your thoughts, and your eyes, it focuses the brain. And over time, that focusing gets a lot easier. Our minds are like pets or children. If we're not if we're not in the habit of doing something, if we don't practice it, if we're not trained, these things, the mind will wander. But the more you practice something, just like any sport or any sort of hobby or being a musician, you got to practice it. And so at first it's difficult. But over time, as you do it, it gets easier and easier to get into that meditative state, and that will help your focus a lot. And so anyone who has issues with keeping their attention, of productivity, I highly encourage meditation because it's going to train your brain to focus better. Now, the open monitoring, mindfulness meditation, this is also a great route to take, and this is gaining popularity. And so with mindfulness, You don't need to go blank. You're just observing. You're looking at everything that passes through your mind. You're observing the sensations, the sounds, the smells around you, any sort of bodily sensations if you feel tight or painful in one area, or if you feel relaxed. You're just observing. And the main thing is that you're not pursuing any of those thoughts. So if a thought enters your head, if you pursued it, it would be, oops, I got to email that person. What am I going to say? Okay, and then I got to email that person. Following that train of thoughts. Whereas with mindfulness, you stay off the train. You see that thought pass by with the email, and you just see it. And then you wait for the next thing to come by. You don't engage with it. So, meditation, the important thing is there are so many types. And if one doesn't work for you, try another. But it's really important for us to focus our brain. It has amazing things on stress reduction and on our longevity. We'll talk about it again in week 5. Okay, so how often do we stress reduce? What's a good amount? First of all, every day. I talked about this before. Think of it like any sort of daily function. It's just something that you want to get in the habit of. And when you're in the habit of doing it, you're not even going to think about it. Um, Excuse the pun. But if you're not, but at first it can be difficult to get into that habit. But it should be easy. Now, I would say as little as 15 minutes per day. And this doesn't have to be all at once, although as you practice, it'll get easier and easier to do longer segments. But maybe you start with 5 minutes 3 times a day. You do it when you wake up, you do it during your lunch break, and then you do it before bed. Maybe you pick some times throughout the day when you start to feel your energy go down or you start to feel stressed, and you go outside and you do some deep breathing. Take a walk, do some deep breathing. Maybe you walk on the grass barefoot, or you just sit out in the sun and you breathe. And then you go back to work and you feel more energized and more happy. And so it can be scheduled, or it can be something that you do when you feel the need to, or I would say even better, a combination of both. So implementation ideas, we talked about that. A 10-minute break in the middle of your workday to breathe and clear your mind, kind of break up the day. Maybe you journal. Journaling is another great way to stress reduce for people who like to write especially. You journal at the end of the day for 20 minutes. Having a healthy hobby, drawing, painting, reading, singing, dancing, all these things can be good hobbies. Um, Good for you, good for the mind, good for the spirit. And then we talked about meditation, yoga, exercise, breathing. And I would definitely encourage you to do some form of if exercise is one of your stress reduction techniques, that's good, but I wouldn't have it be the only one. You can't always be on the go. Some of the stress reduction should be the silent or reflective, oxygenating type. And so now take some time to answer number number 6, 7, and 8, and that's going to lead us into setting the goals. So what is an ideal stress practice for you, and how realistic is this? You want to be meditating for 30 minutes at a time, and maybe that's not a good place to start. Or maybe you just don't have time for 30 or 40 minutes, and maybe 15 minutes is more realistic. So write that down. Next, how would you rate your current use of stress reduction? And so, especially looking at numbers 4 and 5, are you doing a lot of unhealthy stress reduction responses? If so, then you're closer to a 1. But if you're doing a lot of healthy responses already, now you're closer to a 10. So give yourself a rating on how you're doing right now. And then think of what's a step or maybe a couple steps that you can do right now to increase the quality of stress reduction in your life. So pause the video and take some time to do that now. Okay, so it's time to set your goal. What is your goal for this week? And I encourage you to make some goal for stress reduction that somehow ties to your bigger goal. And so one of the intentions of this program is that you get to experience different lifestyle healthy lifestyles. And so even if you're overweight, you want to exercise more, I don't want you to just exercise more. I want you to experience all of the healthy lifestyle habits. That way you get some experience with it. And so, but at the same time, hopefully the worksheet has showed you that it does relate to your health in some way. Now, let's take the example of losing weight. Now, when we're stressed, first of all, cortisol increases the amount of weight that we put on. Also, when we're stressed, we don't always make the best decisions for our health. And so, again, even if you want to exercise more to lose weight, the stress reduction can help you get there. You can make better decisions, you can be more energized to exercise, and you can decrease your cortisol so that hormonally you're more in balance. And so, start to think of how stress relates to your overall goal and your overall health, and then think of what you can do to stress reduce. And think of a SMART goal for this next week. Okay, so to summarize, talked about heart disease, many different forms, and it's very prevalent in our society, especially in men. And when it comes to heart disease, it affects every other system in the body. Getting blood and oxygen to our cells keeps them alive. Now, when it comes to heart disease, stress is a major component. And we also talked about metabolic syndrome, which stress is linked to. And so, stress is something that we need. We don't ever want stress to be zero, because then we won't be healthy with that either. The main thing is being able to manage our stress, to add on stress to a healthy amount, and then decreasing it. That way we don't get overwhelmed and overstressed. And this is especially important when life happens. If we're busy at our job, if issues at home, issues with family, issues with our health, these are the times when we need to increase and beef up our stress reduction, because it's going to help keep us in balance, and it's going to help our entire body, and especially our cardiovascular system. Sleep is very important. I encourage everyone to get enough quality and quantity. That has to be a priority. And then also stress reduction. Breathing techniques are easy. They can be very quick too if you need them to, and they're free. We can breathe for free. And the same thing with meditation. It's easy. You don't need to have anyone to help you, and it helps also focus your brain. And so that's something that as we get older, we're going to talk about this in week 5, really important to keep the brain healthy. So stress reduction, really focus on your stress reduction this week. Extra resources, we have one on the 10 health problems related to stress. These are 10 of many, many. And so how are some ways that stress might be affecting your health? There's a handout on sleep hygiene, some tips, some do's and don'ts about quality sleep. There's 3 breathing techniques, and these can melt away stress in under 3 minutes. They're so quick and easy to do, and some of these you can do them without anyone knowing. You can be in a meeting and doing a breathing exercise, and nobody knows what you're doing, and you're feeling better. And then a list, a good infographic on 101 stress relievers. There are so many ways to relieve stress, and so depending on your personality, depending on the day, depending on what you need right then. There are so many ways for us to relax, and so there's no excuse that I can't relax. There are so many different ways. It's just about making it a priority. So next week, this week I hope you have I hope you encounter stress, but then you release it very effectively. So next week we're going to talk about diabetes, obesity, and nutrition. And we probably all know that these are really linked. So what is diabetes and obesity? Why is it so common? What are some fad diets? Why should you say no to them? And what really makes a healthy meal? What is good nutrition? And how do you make a meal healthy? So that's going to be next week. I hope you join us for that then. In the meantime, have a healthy week, have a happy week, and we will see you next week. Bye-bye.